As we mark the last day of February, Heart Health Month, we are talking about a disease that kills more men and women every year than anything else.
And that is heart disease. It kills 630,000 people every year. So joining us to talk about it is Dr. Sabrina Fabi. This is still every year the #1 killer of men and women. Talk to me about why that is.
I know, and it's something that's so preventable, really. So one in every four women or men are affected by it. 1 in 3 women die every single year, whether it's heart disease or actual stroke. And the thought is, with women specifically, is that they usually have symptoms that don't necessarily correlate with a heart attack. So they tend to attribute it to maybe anxiety or arthritis or just stomach upset. So they tend to not show up to the ER probably about 54 hours later after starting to experience these symptoms, where a man may show up after 16 hours because their wife tells them to go get checked out.
Right, maybe about 90% of women have these risk factors, is that right?
Right, because the risk factors include high blood pressure, high cholesterol, specifically LDL, so that's something that you can easily check and get on a medication to lower. Smoking puts you at risk as well. So these are risk factors that you can easily minimize, and yet we still see such a high risk of disease.
Talk to me about where California ranks. You'd think that we would be in the category of more people who are healthy because more people are outside, a lot of people are active. Where do we rank in this?
We're actually 40th amongst the 50 states. So not too bad. And it's probably because we have a more active lifestyle, so we are out and about versus other areas in the country where people are a bit more sedentary, because obesity also is a risk factor for heart disease. And so obviously you can prevent this by being a bit more active, eating healthier foods, right? Because when we eat certain foods like red meats and things that increase the inflammation in our body, we're also increasing that inflammation in our arteries.
And you think about diseases like cancer, where so much money and research goes to, and so much awareness, like we got to do something to fix this problem. Well, here's a problem that affects more people than anything else. Why is there, I guess, the push to at least inform the public more and put more money toward a campaign to let people know that they can prevent this?
I think the American Heart Association does a good job. I know that as a dermatologist, we see conditions and we know more and more that it has to do with inflammation. So in our patients who have psoriasis, for instance, we know that there's a greater risk for a heart attack. So that overall hyperinflammatory state, being in a state of a lot of inflammation, whether it is because of eczema or whether it is because of psoriasis, there's definitely a link that all that inflammation also affects our blood vessels, and that's the reason why we're at risk for a heart attack. But also patients have to participate in their own health, and so we're still in a country where more than 50% of the population is obese, and that's one of the leading risk factors. And that also puts you at risk for diabetes, which puts women specifically at 4 to 5 times higher risk for a heart attack than their male counterparts.
Wow. Well, maybe the end of February, where we were raising awareness about Heart Health Month, everyone wearing red, but we can still continue that as we go into the later months.
Yeah.
Dr. Fabi, thanks for being here.
Thanks for having me.
Thank you.